Hey beautiful soul, welcome to the Lost Labia Chronicles, where I discuss all things lichen sclerosus. So if you have lichen sclerosus, or you have a friend or a loved one that has lichen sclerosus, and you want to empower yourself with information to support yourself or others, and if you have lichen sclerosus, if you're looking to find acceptance and reclaim your life, then definitely subscribe to this channel and keep on watching. So in today's video, I'm going to do another terminology fundamentals video where I discuss the terms remission and flare or flare up. So I'm going to explain those terms. I'm going to give some illustrations and examples, and then I'm going to talk a bit about my lived experience with both and what that's looked like for me. And then I'll wrap things up really quickly with a brief, little discussion about why these terms are important in the first place. So if that sounds like something you'd be interested in, keep on watching. So let's start with remission. What is remission? What does it mean? So remission is basically when there is no more active signs of lichen sclerosus on the vulvar area or the perianal area. And this is something that will be determined by your doctor. Now, it's important to note that not every doctor is going to examine you and say, you're in remission. So sometimes what they might say instead is, so you go in for your follow-up and they're looking and they might say, there's no more active signs of lichen sclerosus. Or they might say something like, your lichen sclerosus is extremely well managed. You are doing really good. And then they might follow up and say, if I didn't know any better, you could never know that you had lichen sclerosus. Your vulva looks, extremely healthy. So they may say stuff like that instead of using the explicit term remission. So, something to be mindful of, because some doctors, for some reason or other, I don't know, they are, they don't want to use the phrase remission. I don't know why. I suspect that it's because they fear that using the word remission will lead their patients to no longer medicate and treat, which I will get into a bit later on. But that's just a guess. I have no idea why some doctors use the phrase and some don't. But essentially that's, there's no more active signs of lichen sclerosus on your vulva. Now, in a paper by Dr. Lee and Dr. Fisher, when they're discussing, the trajectory of patients getting into remission, they state that once a patient reaches remission, that the color and the texture of the vulva or anal area will return to normal or as close to normal as possible. Okay, so what do we mean by this, as normal as possible? Because this seems like a fussy gray area. So in some cases, a patient can go into remission and still have some residual hypo or hyperpigmentation. So in this case, you might have a little bit of kind of like a dark red, like a crimson purpley color. So there might be some areas where you have that dark reddish purple, or you might have some residual whiteness. But in general, despite some residual, discoloration persisting, the texture of the surface of the skin will dramatically improve. So that thickened, kind of hardened skin, that will kind of return back to normal. So again, when you are in remission, it is possible to have a little bit of residual discoloration, but the discoloration overall and the texture of the surface of the skin are going to have dramatically improved. So that's a little bit about what remission is, what it means. And I now want to discuss remission in the context of symptoms. So okay, so you're in remission. You have no more active signs of LS. You may or may not have a little bit of residual discoloration, but overall the texture and color have improved dramatically. What about your symptoms? So in most cases, you're gonna also, remission will be accompanied by a dramatic improvement in your symptoms. Now, whether this means your symptoms completely disappear or you have a little bit of symptoms or issues still in remission, kind of depends. So in my case, I've been in remission for over a year and a half now. And for me, the color and the texture of my skin obviously have dramatically improved. For me, I have no more residual discoloration. So my vulva, the areas that were pink, have now completely returned to that pink color. And further, when, at my last follow-up, my gynecologist was like, you'd never know you have lichen sclerosus by looking at your vulva. It is so well managed, which of course is nice to hear. So yay, remission is awesome. Now, in addition to all of this, I actually, ever since being in remission, have no more symptoms. So I have no more itch, I have no more stinging and burning, I don't get any more fissures, I don't tear, I don't have profound extreme dryness or discomfort. That's all stopped completely. And then let's talk about, so those were some of my main symptoms. And then in addition to this, I also had architectural changes. So as you probably know, if you've watched some of my videos, including my diagnosis story, which I will have linked in the description box below, you'll know that I've basically lost like the majority of my labia minora. So when I was diagnosed, my labia minora had significantly fused to my labia majora. And then because I didn't really receive proper guidance on how to use my steroids and where to use my steroids, I wasn't using them properly, and that fusing quickly just reabsorbed. Now, if you're watching this and you're wondering what the heck I'm talking about, what is fusing, what is resorption, these are two other very important terms to note when it comes to lichen sclerosus. And I do have a video on the distinction between the two. So if you haven't watched that yet and you're wondering what the difference is or what they even mean at all, just super fair, because like nobody teaches us this, okay? I will link that in the description box below, so definitely go and check that out. But yeah, so I had lost the majority of my labia minora, and then I had quite a lot of fusing around the clitoral prepuce, which is the clitoral hood, to the glands. So in my case, you can't really retract the glands. You can't pull back the hood because there's so much fusing around that. So I had clitoral phimosis and labia minora resorption. However, ever since being in remission, I haven't experienced any further architectural changes. So I still have the top of my labia minora, and actually there has been some unfusing around the clitoris, which my gynecologist noticed at my last follow-up, which is dope, I'll take it. I had pretty much, I had come to a place of strong acceptance. I love my vulva, fused and resorbed. I love her, I'm happy with her, but hey, if there's someone fusing, I'll take it. But yeah, so typically if you don't treat your LS, the disease as it progresses, you can have more and more architectural changes. So I could have developed fusing around the introitus, just that vaginal opening. I could have had further, clitoral phimosis. I could have lost the rest of the labia minora that I do have. So no more architectural changes. And then one of the biggest and most important changes for me was the fact that, and because again, if you've watched my diagnosis story, you know that painful sex was my primary symptom, especially early in my 20s. So sex is now pleasurable. I no longer have any pain. I no longer tear open from penetrative sex. So honestly, remission has been a huge blessing. I can have sex, I don't tear, I have no more symptoms. Now, with that said, this is just my personal experience with remission, and remission is going to look a little bit different on everyone. And this depends on so many factors, such as how are you treating? How progressed was the disease by the time you got diagnosed? Because, if you got diagnosed super late and there's severe fusing, your journey is going to look very different from somebody that gets caught early and has a mild case and treats the right way from the beginning. So with that said, some people can be in remission, and in fact, the color and the texture of their skin can return back to normal, but they might still have some symptoms. So here's the why behind that. What you can experience is you can be in remission and you might still have some fissures and you still might tear. And this is because in certain cases where the fusing and the scarring has gotten really advanced, there might, I'm talking about like significant cases of architectural changes. Because of those changes, your skin is kind of more likely to tear during certain activities. So it is possible to be in remission and not maybe completely be symptom-free. There still might be some bumps in the road. And if you're watching and you think this could be you or this is you, you might want to seek out a vulvovaginal specialist and discuss your options, such as surgery to, for example, release the clitoral hood from the clitoris. If there's severe scarring at the entrance of the vagina and that's causing you to tear constantly with penetration, they can surgically, go in and kind of fix these things so that you can regain function. And in addition to regaining function in opening you up and giving more space, there might be less tearing. So maybe then after this, you can have no more symptoms. It's always the goal, of course. Little to no symptoms. So that in a nutshell is what remission is. I am going to show a quick little drawing that I've done. And I usually illustrate this in the Lichen Sclerosus support virtual meetups. Again, I apologize. I work a full-time job. I do my blog. I do these videos. I do everything for the Lost Labia Chronicles. And so, I'm learning, but I only have so much time. So I still, I'm not like super good in the video editing world and all of this. So I don't really know how to just like put up images and stuff like that, make it look cool. So I'm going to show you on my paper like I did I think I did it in the fusing video. So basically I've just done a really simple illustration of my understanding of remission and what that could look like for certain folks. And I just want to do this for all of my visual learners out there. I am one of them. I cannot sit through a lecture if there are no visuals. I really have a hard time grasping concepts without a visual aid. So here we go. So, okay, here's the diagram that I've made of remission. So here on the side, we have 0 to 6, 0 just being no symptoms. So here's what a typical remission trajectory might look like. 0, maybe like 0.3, 0, 0, 0, 0, maybe close to a 1, 0, 0.3, 0. And, essentially what I'm trying to illustrate is that the symptoms that you experience in remission, if you experience them, they're not going to be these huge spikes. You're not going to go from a 0 and then shoot up to a 6. You're likely to kind of hover between, this smaller little area. So these bumps, they're not so distinct and sharp. And this will make more sense when I show the flare up diagram. but this is kind of what it's going to look like. Now, this is maybe more what it would look like for me, for someone that has 0 symptoms. So maybe occasionally I get like the tiniest itch. It happens for like, 20 minutes and then it kind of just goes away. Just really small things. Ooh, I feel a little discomfort today, but I'm otherwise okay. 0. Now, you might be at a 2. Your remission, say you're one of those folks that has some tearing and some, residual symptoms, even though you are in remission, then you would kind of hover around the 2 and the 3 for your, what your symptoms would look like in remission. Okay, so that's remission, and I'm going to now discuss the kind of, not the opposite, but I guess kind of the opposite, flare or flare-up or being in a flare. Okay, so now let's talk about what a flare or what a flare-up is. So a flare is essentially a significant deviation from your baseline. So when I say your baseline, I'm talking about what your symptoms look like in general. So essentially, your baseline is used as a point of comparison, to kind of see whether your symptoms or your LS is improving or if you are flaring or having certain issues. Are your symptoms getting better or are they getting worse compared to this baseline? So let's say that this baseline of symptoms is rated on a scale of 0 to 10. Where 0 is you have no symptoms and a 10 is the worst symptoms possible, like the pain, the itch, everything is just unbearable. So we're going to rate it on that. And then to illustrate a little bit further what flaring or being in a flare means, we're going to look at myself and a fictional character that I'm just going to call Anna. So for me, my baseline is 0 because, as I've mentioned, I'm in remission, and remission for me means no symptoms. So that's my baseline. That means that on the majority of the days of the week, I don't have any symptoms. Now, let's say in Anna's case, Anna isn't yet in remission, and her baseline sits at around a 3. And for simplicity's sake, let's just say that our one and only symptom, so me and Anna, I'm 0, she's 3, this pertains to itch. Most of us have more than one symptom, but I just want this to be really simple to illustrate the point. So we're gonna have 2 different cases. So case 1. In case 1, my baseline, I noticed that, there's a couple days where there's a slight little itch. And if I was asked to rate that itch, I would maybe put it at a 0.5 to a 1.5. So there's a little bit of an itch, but it's not anything significant. I haven't done a huge deviation from my baseline, right? It's kind of subtle, and it might not be persistent and it may not last too long. So maybe, I'm working at my desk and it's like, oh, a little itchy down there. Okay. And then I move on. And then later that night, let's say I'm watching television and the itch kind of comes back, but it's really mild and, it lasts about 10 minutes. And maybe this happens for a couple days and then just kind of fizzles out. And then let's say that Anna, she notices that, her baseline is around a 3, and all of a sudden she's thinking, this is a little bit more than usual. Not a significant amount, but I kind of feel like there's a little bit more itch. So maybe her baseline is kind of moving from a 3 to like a 3.5, maybe a 4. And again, it's kind of not persistent. It's kind of more random. It's very mild. And again, it just kind of fizzles out after a couple days. So this case 1, is not constituting a flare. Just kind of a little bit of deviation, but it's really small and it just kind of goes away on its own and it doesn't last long. Now let's look at case 2, and case 2 is going to constitute a flare. So in case 2, my baseline suddenly jumps from a 0 to a 4. So, and further, this 4 is quite persistent. So it's not just a 0 to a 4 for like a minute and then that was it. It was just some kind of random fluke. no, this kind of sticks around for a couple days. And so I'm just kind of more consistently itchy, and the itch is a very pronounced itch, going from no itch to, ooh, that's an itch. And then in Anna's case, so Anna sits around a 3, and so she still has an itch, whereas I didn't. So she still has an itch, but all of a sudden, let's say one night, she just kind of wakes up and her itch is like a level 6 or higher. So again, there's a very sudden worsening of our symptom, which is itch in both cases. So this case constitutes a flare for both of us. So to illustrate this and to show the difference between, kind of flare and remission, I'm going to, again, show me a little drawing. So again, remember that remission, we're pretty stable. There are some peaks, but they're very, very minor, and they don't really last for like a consistent length of time. Now with a flare, on the other hand, you're gonna look kind of like this. So here's your baseline, and then it's a quick shoot up. It's very, very sudden, and it's very, very sharp and distinct, and there is a huge deviation from your baseline. And then, as you kind of come out of that flare, the symptoms, you kind of return closer and closer to your baseline, and then you go back to that baseline. And again, these little tiny, little kind of moments, not really flaring, just be mindful of those, and, but this dramatic peak, that's the flare in both cases. So this illustration is quite simple. And again, I use the symptom of itch because it happens to be one of the more common symptoms. But again, most of us have multiple symptoms, right? We have like itch, burning, tearing during sex. So when you're trying to determine whether you're in a flare or not, consider swapping my general itch for whatever your symptom is. If you never have itch, but you only have burning, and suddenly you go from whatever number your baseline is to a sharp increase, and that increase stays and sticks around, that would be a flare. So, and again, same thing if it's like a mixture of symptoms, if it's itch and burning, and again, you're at your baseline, and then all of a sudden your itch and burning just gets out of control, and it's extra, extra bad, and it's persisting, then that would be a flare. Now, it's also important to note that all of our baselines are going to be different. So just because my level 4 seems pretty low compared to somebody's level 8, but if the level 8, if their baseline is a 4, but my baseline is a 0, we're still doing this big increase. So don't think that you need to be at a level 10 or like an 8 or higher to constitute a flare, because that's not necessarily going to be the case. You don't need to have like the most unbearable symptoms of your life. What you're looking for is that sharp deviation and that big peak in your symptoms. So again, a level 4, some people might dream of being a level 4, but for me, a level 4 might be my flare because my baseline is a 0. So it's always important to know that baselines and people's pain thresholds and all of these things are very individualized. So when you're trying to understand whether or not you're in a flare, try and remember that diagram of the sharp thing and know where your baseline is. So if you are not sure where your baseline is, one suggestion I do have to you, if you're interested in knowing where your baseline is, and if you feel like you're in a space where this feels good and safe and right for you, you could consider tracking your symptoms via some kind of symptom tracker. There are multiple apps. Lichen Sclerosus podcast has a free symptom tracker, which you can download at www.lssupport.net/symptom tracker. So you can go there, and I will also leave a description for that, the link in the description box below. So you can track your symptoms. So if you track let's say you track your symptoms for a month, and you're rating the intensity of your symptoms on the scale of 0 to 10, and you see predominantly 5s, then that kind of tells you that 5 is your baseline. And then you can kind of look at your symptoms to see what you logged. Is it 5 and itch? Is it 5 itch and burning? Is it 5 and fissures? Whatever it is, this really gives you a strong sense of what your baseline is so that you can really be clear on when there is that sharp deviation from your flare. So let's just talk really briefly about what happens when you're in a flare. So let's say you do realize, okay, I jumped from my baseline, I am definitely in a flare. What the crap do I do? So the following advice really is the general protocol for what to do when folks find themselves in a flare, but it is just that, it's general. I'm super sorry if you can hear those sirens in the background. Okay, they're done. What was I saying? Right, if you're in a flare. So the general kind of protocol is to return to the initial treatment protocol. So when you first get diagnosed, you're kind of returning to that. So if you don't know what that general protocol is for treating lichen sclerosus, I highly, highly, highly recommend that you check out www.lssupport.net/Dr. Jill. Lichen Sclerosus podcast conducts a phenomenal interview with Dr. Kraft, who talks about the general treatment protocol for steroids, how to best use your steroids. There's just gem after gem after gem of solid information in that interview, so I definitely suggest checking that one out. But when I do talk about returning to your general protocol, that is once every day you apply your steroids for, and your flare protocol may differ in your length. I'll talk about that a bit in a second, but let's say you do once a day daily for 2 to 3 weeks or 2 to 4 weeks. Then you follow the next few weeks with every other day. So Monday, Wednesday, Friday, Sunday, etc. And do that for, again, 2 to 3 weeks. And then at that point, assuming the flare is subsided and you're kind of back to that baseline, then you return to your maintenance protocol, which is using your steroids 2 times a week, and you just kind of go on. Now, again, this is the general protocol, but everybody's flare is going to look different. And so I strongly advise you to please consult with your healthcare provider and, discuss with them how often and what that kind of protocol should look like for you, because I am not a doctor and I cannot be a substitute for medical advice. But that is just in general what that kind of looks like when you are in a flare. So as a recap, remission means that there are no longer any active signs of lichen sclerosus on the vulva and anal area. It means that further, there is dramatic improvement to the color and texture of the surface of the, genital skin. And it may or may not be accompanied by 0 symptoms, but there will be a dramatic reduction in your symptoms, whether that's no symptoms or extremely mild and rare, kind of varies from person to person. And then a flare is that significant deviation, that significant worsening of your symptoms that deviates from your baseline. So going from a level 3 with your symptoms to a level 6 or 7 or higher. So that's the difference between a flare and remission. And why this matters is, again, it kind of plays into, well, 1, empowering yourself with knowledge, and 2, how are you communicating with your doctors? This really, really matters, especially in this, pandemic kind of time where a lot of us are consulting with our healthcare providers through phone consultations. So let's say I tell my doctor, let's say I have a little itch. I went with 0 symptoms for a long time, and I'm working at my computer and I feel a sudden itch. Now, that itch doesn't last very long, but it causes me to panic because I have health anxiety and anxiety in general and panic attack disorder and all of this. I freak out and I call my GP and I tell her, I'm having a flare, what do I do? Now she might tell me to go back to the once daily clobetasol, and she might set me on a flare protocol. But if I'm not in a flare, using that much steroid when there is no flare could be quite irritating for me. And in fact, that much steroid when you're not in a flare isn't necessary. So the way that we communicate with our doctors matters. So instead of me saying I'm in a flare, I might say, I just want to, have a little conversation and get to know things better. Is it normal to sometimes just feel a little occasional itch? And so in this point, she just might educate me instead of putting me on this, daily steroid thing. Knowing what remission is extremely important, because when you're diagnosed with lichen sclerosus, the goal is to get yourself into remission. Everybody wants to be in remission because it means that visually things have really improved, and it means that symptom-wise things have really improved, and we really just want the best quality of life. And so since lichen sclerosus cannot be cured, we want to get the next best thing for now. Fingers crossed one day there will be a cure, but for now. And the next best thing would be remission. So it's important to know that this is a thing, what it looks like, and that, it's achievable. I've been in remission for over 1.5 years. I know plenty of folks who have gotten into remission. So it is important to know that it is the goal. One final note on remission. Remission does not mean you are cured. Remission does not mean you don't have LS. Now, I'll be honest with you, I don't feel like I have LS anymore because I have no symptoms. But because I've educated myself and because I know how, I have an idea of how this disease works, I've read the medical papers, I know that I'm not cured. And for this reason, despite me having no symptoms and never thinking about LS for myself personally and kind of feeling like I'm the most normal I've ever felt down there, I know that I need to keep treating. So I am very dedicated to staying on my maintenance protocol, which means 2 times a week I apply my steroid, Monday night and Thursday night. So again, remission does not mean that you are cured. You still need to treat the inflammation that causes lichen sclerosus, even if you have no symptoms. Okay, so that's a wrap for the remission and flare fundamentals video. I want to thank you so much for watching this video. If you found this video to be helpful or informative, I would super appreciate a thumbs up and a subscribe to my channel. I'm such a new channel here, so I would really appreciate your support in helping my channel grow. The more likes and subscribes and comments, the more we tell the algorithm that, my content is important, and the more, my reach expands and we can reach more people. And this is so important because we really need to raise more awareness. The more awareness, the more educated people become, the more we can start to catch this earlier, the more funding we can get for research and different, methods of treatment. So it's all very important. Let me know in the comments down below if you've learned anything new. Maybe share what remission means for you or your journey or struggle with flare-ups. Let me know in the comments below. I love hearing from you. And that's it for this one. I will catch you in the next one. Bye.